My name is Lena Bolivar. I was diagnosed in September of 2011 with idiopathic pulmonary arterial hypertension. I noticed my shortness of breath in 2009, early 2009. And I thought, okay, I had had my son a few months before, so I needed to get back into shape and it would pass. I noticed it was becoming worse over time, and I saw a few doctors. And initially, they thought because I was a mother, a wife, working full time, that it was either anxiety, stress, or depression. And so from 2009, I saw about 3 doctors. And then in 2010, I started passing out. Once I remember I was walking up a hill in San Francisco and I could barely make it to the hotel room. The second time in 2010 was I was on vacation and it was very hot. And I had tried to do some hiking, and I was so out of breath, and I passed out. And then I was diagnosed over a year later in 2011 in September. So it was a long process, but I think it's because a lot of doctors look towards one area. I had even asked one doctor if I could have a stress test because I felt like I had lost some weight and, there was no reason for the shortness of breath to be getting so bad. And he says, oh, you don't need a stress test. I think you have exercise-induced asthma. And so I kind of just hung on to that. And then finally it got so bad that a friend of mine knows a very well-known cardiologist in the area where I live, and he saw me, and they did the echo and saw that my heart was enlarged, and so that's why they sent me to Stanford. I think the first thing would be to take a long, deep breath, because for me it was overwhelming. And the other piece of advice I was given was to advocate for myself as a patient. It's something that you want to be able to educate yourself as a patient. Ask questions, even if you think they're silly questions. Ask them anyways. And really find out what your sense of purpose for living is, because you're really going to have to draw into that during however long your process of dealing with this progressive diseases. I know that gave me a lot of strength during the 6 years, and I think it will give you a strength on days that you really, really need it. As soon as I was hospitalized, upon evaluation, I was put on Flolan, an IV medication, and I chose Flolan for my IV medication. I was also placed on Revatio and Upsummit, and of course the day-to-day drugs as far as Lasix, which is the water pills. I was then given an opportunity to be part of a study here at Stanford. And so that gave me about 5 extra years before I needed to be transplanted. I think early on I made a decision that I was going to do everything that I could to either beat the disease or live with it the best way I could, because I had 2 small children. I think it helped that I had a lot of support at home, and that helped a lot. Family, friends, at work, all of those things made a difference. But I think the decision I had made that I was going to do whatever I needed to do, as far as medication, educating myself on the disease in order to live as long as I could with pulmonary hypertension. I think because at the time my children were 5 and 3, they really didn't notice a change. They noticed that I couldn't pick them up, or mommy was sick a lot. Because before that, I would pick them up. I didn't know any better. But there were things that they missed out on. I couldn't take them on trips initially, but we got over that, and we ended up traveling a lot during my 5 years, 6 years since my diagnosis, and we traveled a lot, and they coped, but they were very grounding, very supportive, and my husband bore a lot of that, the brunt of pitching in, doing a lot of the work, taking care of the children. So I had that, so I was very fortunate. As far as the PH team, I loved the doctors. I still consider them a part of my family. And my social worker, Allison, was amazing. And my nurse practitioner, they were so great. They added the second component to my life, where the first part of it was the support from my family and friends. So I was very fortunate as a patient to have both. And I drew on a lot of the strength from the doctors. They had seen me at some of my most vulnerable times, and they were there for me, and I knew I could always pick up the phone and ask them a question, and so that was very helpful to me. Amazing. From my initial evaluation with Dr. Zamanian and then meeting the rest of the team, I have always told everybody that the first thing that struck me was the empathy that I felt with all the doctors. And it carries on. You meet new doctors through the process of 6 years, and everybody is so caring and answer your questions. You never feel like a bother or that you're taking too much of their time up. And you know that they only want the best for you, and they're doing their best to help you move through your process with this disease. My first experience was for my evaluation. There was already a CT scan that was done. I met Dr. Zamanian, and based off of the answers I gave him to his questions, he decided to hospitalize me as soon as possible. And his instincts to do that were correct. I was maybe about 3 months away from being severely either dying or not being able to come back, being very sick. So I was hospitalized, and I met the team right away. From every doctor that was going to see me, that was going to do rounds for the next week. I was then, of course, you have to go through a series of testing, which was overwhelming for me at the time because I had never been hospitalized before, other than giving birth. So that's only a couple days. And then we went through the testing, but the doctors were great about explaining the reason for the testing, why they were doing it, the results. Finally, with the right heart cath, it was confirmed that I had PAH, and we talked about the options for the infusion therapy. And so I felt that I made the right choice, And then, you know, you have to titrate the medication, and that was basically my experience. That's kind of why the hospitalization was a little longer. And then you have somebody who comes in from the medication company that explains the teaching to you and all of that. So it's an overwhelming period, but you have so much support here at Stanford from the nurses, just the nurses on the regular floor that have nothing to do with the PH team. They're great too. And so it was an overwhelming experience for me, but very educational. And I came out a stronger person because of it. I was transplanted on June 4th, 2017. The scariest part was I knew I was going to die without the organ transplant. And of course, with my children, I didn't want it to die, and they were my reason for living and for fighting so hard. The best part is I've had a year of just making more memories and more time. That's all it is. Transplant is not a cure. It buys you more time, and it's how you live during that time. I had my 1-year anniversary in Portugal. So I was thrilled on that day. And I thought, you know, of where I was a year before, hooked up to ECMO, and it was, you know, I'm so grateful. And that was the best part.